Good evening, everyone. Dr. Staci here. Welcome to our Tuesday night educational informational Zoom on LifeWave's technology. Before we get started and dive into this PowerPoint presentation, I definitely want to let you know that the information you're learning this evening, whether you're a guest or a brand new brand partner, is for informational purposes only. I am not a medical doctor. I'm not your medical doctor. And so if you have any questions in regards to your health, your medicines, or anything to do with your healthcare, please check with your healthcare practitioner or doctor in charge of you. They're going to be able to help you make the best decisions, of course. With that being said, the information I'm sharing, even though it is going to be amazingly mind-blowing, as I'm sure you do find from week to week hearing from different people share about this technology, it is not intended to make any diagnosis, to treat, cure, prevent any disease or illness. And of course, if you're pregnant or nursing or on medications, check with your doctor and healthcare practitioner. We hear that disclaimer every single week, but of course it's important we have to say that because some people may assume that we're making claims to diagnose and we're not. So with that being said, if you caught last week's Tuesday night Zoom, I interviewed two fantastic men, and I personally cannot quit talking about their testimonials. That's why we listen to testimonials all the time, right? Because people just have such remarkable stories, whether it's a short term or a long term or somewhere in between or all of the above. So if you haven't caught that one, go back on my channel and check the replay because it is fantastic, and you will want everyone to hear from Jeremy and Bob, who have been patching for significant amount of time and had massive changes in their health. So I kind of want to piggyback on that theme of talking about pain and inflammation and chronic situations in the body and how we can best support the body and what patches do different things. So I've created just a little PowerPoint presentation that I'm going to share with you guys because I think visuals are important too. I used to be a school teacher, and I know auditory is not how most people learn, right? We definitely, well, a lot of people do, but we definitely want to see things as well. So being able to visually see it and be able to auditorily hear it, it's going to help you guys to take things in a little bit further, I think. So with that, let me pull this up here. Okay, so I think having my box over there, I should be good to keep that to the side. So we're going to talk a little bit about this pain and inflammation that's happening with LifeWave and how we're being able to help people with this. We're going to talk about X39, 49, Aeon, Glutathione, and IceWave, and I know that may sound like a lot, but we're just going to give little snippets of information about each. The problem here is we have about 1.5 billion people on this planet that we know of that are living in chronic pain. And so what's the option here? What's the solution, right, to this modern health crisis that we know is linking to the inflammation in the body, is linking to diseases, over 60% of the disease process, if not even more than that. And you all go to your doctor, and your doctor's going to tell you, oh, you have inflammation, your inflammatory markers are through the roof, yada, yada. Here's why you have XYZ, condition or issue. And we know that over 50 million Americans are living with chronic pain. And we know pharmaceuticals manage symptoms, but they're not getting to the root of the problem. And that's where LifeWave comes in. So we are a non-transdermal light therapy. This is what our patch looks like if you are new to LifeWave. It looks like a little round Band-Aid. But non-transdermal means nothing's entering the body. No medicine, no chemical, no herb, no nutrient. Nothing enters the body except a wavelength of light. Obviously, light therapy. We're different than your traditional light therapies like sun, sauna, red light therapy, lasers, things like that, because we don't need an outside power source, an outside wavelength of light to do anything. We power the patch. So when we get up in the morning, we put our patch on, we leave our patch on for 12 hours. The second you put it on, a wavelength of light from the patch, because our body's heat is activating it, that wavelength of light enters the body and starts some kind of biochemical change. Something is happening, whether we're elevating a peptide or we're activating a specific process in the body. And we're backed by over 90 clinical studies, and obviously I'm not going to go through them all with you, but show that we actually are doing exactly what we say we're doing, whether we are elevating GHK or AHK or epithalamin or triggering beta oxidation, whatever it may be. You can see our studies. And for those of you that are brand partners, go into your back office. Click on your resources tab, which is on the far right-hand side, and scroll all the way down to the bottom of the far left-hand side, and you will see a button that says studies. And they're all there broken down into the different categories, which are the different patches that we have. And so you can look at those studies yourself and maybe make sense of them, maybe not, I don't know. I recommend you go to the very bottom where it says conclusion and read what it says. That's the summary of that study, and you'll kind of get an idea, right? That beginning, that abstract, and then go to the bottom to the conclusion. And of course, if you want all the details, please feel free to read it. So let's talk a little bit about the X39 stem cell activation for regeneration. So we have a patent that states that we elevate GHKCU, copper peptide, in the blood, and we activate stem cells. We can see that clearly in our double-blind, placebo-controlled, peer-reviewed studies. This is just one of the studies. We have many, many studies on X39. But the key thing here is resetting genes. So when we talk about pain, when we talk about inflammation in the body, when we talk about tissue repair and wound healing, resetting genes or up-regulating genes to their young, youthful, healthy state has a big part of that. GHK is very well known for reducing the healing time when you look at wounds or surgeries or accidents, breaks, whatever it may be. So we can see statistical significant improvement in the GHK in the body and what happens when we're resetting these genes. So for purposes of pain and inflammation, we're going to talk a little bit about the X49. Now, with the X39, usually people see some changes in the first 3 to 6 weeks with pain reduction. Sometimes it may take a little bit longer. We listened to Bob last week. It was 7 months before X39 got rid of the pain in his feet and his legs. You know, we heard Jeremy last week say 9 days using the X39 and a combination of the patches I'm going to share with you today. So everyone's different in how they respond, and you can use these other patches in conjunction with the X39, of course, because that is our flagship patch, to be able to help you expedite your goals, whatever they may be. Because X49 works differently. This is elevating AHK, and AHK is the daughter peptide to GHK. And so they work really well together. We do find in our studies that X49 is going to help with the immediate pain relief. We see that. And then maybe not so much in the mid, but then again, more towards, you know, the end of the study, which was around 60 days, we could see that increase in the effectiveness of reducing pain in the body. Not to mention it obviously improves strength, stamina, and reduces the bone loss and increasing bone density when you use it synergistically with the X39. We can see that it helps to reduce the soreness and the inflammation in the body. So when we're looking at the bone and muscle support, you know, this is just one of the clinical studies, but looking at that long-term benefit of the reduction of the inflammatory markers in the body and the body's ability to be able to repair and regenerate itself is very significant, very, very significant. And that 39-49 combo, we call that our performance bundle and how they work to help the body. So another patch I want to talk to you about is our Aeon. Now, Aeon has always been, before the release of X39, Aeon has been the #1 patch that LifeWave has had. If you didn't know, LifeWave is actually a 20-year-old company, so we're not new. We may be new to you, but we're not new. And so being that we've had David has invented a lot of different patches over the last 20 years, primarily, they were all before the X39 except for X49, but primarily they were, you know, early on in the beginning of the company. And using Aeon was proven for 10, almost 15 years to be able to help people with the inflammation process in their body, reducing different inflammatory markers, which again, we all know that inflammation leads to disease. Inflammation is a contributing factor to pain in the body. And so we can see that elevating these neurotransmitters in DHA are a key component factor in this. And again, balancing the nervous system is going to help promote that calm state within the body. And you can see here on the picture on the left, there's an Aeon patch there. and you can see the before and the after picture after 15 minutes of using. This is thermal imaging. This is what you can know for a fact, without a shadow of a doubt, that we emit heat or a low-level infrared light, and that is what this technology is working with. And so you can see the reduction in the red and the orange and the yellow in the body, which those are like hot heat, right? There's inflammation, there's probably pain or radiation coming out, not radiation, but radiating of pain coming out of the body. And so we can see that on thermal imaging. So there is that little cycle there with the Aeon patch. You know, we've got the stress, and we've got, you know, the oxidative stress and inflammation, and we've got this cell and organ damage and aging happening, and there's more stress, and then this is like a loop. So when Aeon comes in, it stops that loop so that we're able to calm the stress in the body, calm the oxidative and inflammatory stress in the body, help the cells and the organs to repair. Aeon has huge repairing factors when you look at organ function, kidneys, liver, lungs, you know, pancreas. We can see these improvements in intestines with the Aeon. So that's a really important patch when we're looking at managing chronic pain or even short-term pain. So let's talk a little bit about glutathione. We know glutathione to be the master antioxidant, detoxifier. Why are we talking about it here with pain reduction? So when you look at helping the body to detox, okay, helping to support that immune function and that inflammation modulation, that is a key component to helping relieve the pain in the body. So we kind of think about, if you picture your cells, like these little round cells, they're obviously not this big, but if you picture cells, and inside of the cells are inflamed, and there's toxins in the cells, and so they're probably heavy, right? They're not really doing their job to communicate with each other or excrete the waste that need to come out of the cells, and kind of, you know, what do I want to say, like a little bit more of a, you know, broader idea here of it, but just kind of picture that, right? And so if you can help the body reduce inflammation like the Aeon does, and help the body to remove some toxins from the cell, because we know toxins are stored in our cells. A lot of them are. We want to be able to then see that process of the cell-to-cell communication and the body being able to function better. And so then you see that reduction of the pain a lot of times. And I know, again, we don't normally think glutathione is going to help with my pain. And I'm not saying it's a pain patch. You put it on the spot, it's going to get rid of the pain. But we do find, if you can see here in our studies, that being able to reduce that you know, amount of inflammation is important, and being able to elevate your glutathione by a substantial amount is going to make a big difference in your body. So we also are going to talk a little bit about IceWave. And IceWave is one of those patches, I would say patches, two patches. It's actually using a white patch and a tan patch. And this double-blind placebo-controlled study was a very significant one that was done in France. David was actually there to actually administer the IceWave to patients in the hospital that were not getting relief any other way. And as it goes, if you read the whole entire story, I think it's like 61 pages in the study, but you read the whole thing, you know, they all received pain reduction and elimination using the IceWave. So this is designed to release and reduce pain in the body. Pain is stuck energy. And so when you look at the body's ability to reduce inflammation and you know, help move out the toxins and whatnot, obviously this is not working that way. Okay, so we're, for a situation, whether it's acute or chronic, we're looking for that immediate pain relief, to get the energy channels open, to get the body moving inside. You know, think of energy like meridians, right? To get things moving. But this is one that we're not elevating a peptide, we're triggering that beta oxidation process in the body. And so we want to look at this patch in terms of instead of my Tylenol or my Advil or my aspirin or my pain pill that are obviously all very toxic to our organs, use this to get rid of pain on the spot, to get you through the day, get you through the beginning of your journey with LifeWave if you're just starting, until your X39 and your Aeon really start to get to the root of the problem, because that takes time. We know that it takes time to get the cells in our body up and doing what they're supposed to be doing and finding those areas that need repair and regeneration. But I will tell you this about the IceWave. So there are many different ways you can apply this. Whoever invited you here, ask them for, and I think, Laura, you probably have the videos, don't you, of all of the IceWave? If you could drop those in the chat. But if you can't for some reason grab them in the chat, ask the person that invited you here to get you the videos that David has done. They're 4 to 5 minutes each max. What I think there's like 5 of them. And they give you David standing there with different people, different examples of how to apply this patch for pain reduction and elimination. So in a nutshell, the easiest way to do it is, everybody raise your right hand. Okay, white right. So your white patch would go on the right side of the body. Raise your left hand. The left patch would go on the left side of your body. This works with the polarity of your body. That's why there's a white and a tan, a positive and a negative. So we're opening up energy channels, working with that polarity. The body's communicating with itself. So that's an easy way to do it. If it's your pain on your right knee, then put the white patch on the right knee and put the tan patch on the left knee. If the pain is on the left hip, then put the tan patch wherever the pain is on the left hip and put the white patch in the corresponding spot on the right hip. That's an easy way to do it. But it doesn't always work, because pain it comes from different places. You may think it's coming from the hip, but it's actually coming from somewhere in your back. Maybe it's, something coming down there, or something maybe coming up from your calf that's causing that tightness or stiffness. So it's very different. So here's another way you can do this. And again, David's going to explain it in the videos. But basically, when you look at this patch, see the tan one first, wherever your pain is. So let's say my pain is right here. I'm going to put the tan patch on my shoulder, okay? And then I'm going to take this white one. I'm going to pretend like it's a clock. Now, I'm going to assume that most of you remember the clock when you were growing up. Not the digital thing on your phone, not the digital alarm clock by your bed now, but you remember that clock where there was 12, 3, 6, and 9. So if I have that pain here in my shoulder, I'm going to start up here at the 12 with the white, and I'm going to move it around to the 3, I'm going to move it to the 6, I'm going to move it to the 12. If one of those spots on the clock happens to eliminate my pain or reduce my pain, I'm going to leave it there, because pain radiates kind of like zigzags in different direction. So you'll have to play around with the IceWave. It may work the very first time. I was up in New Jersey about a month or so ago, and we patched, I think, 5 or 6 people, put an Aeon on every single one of them, did the, what's your scale on a 1 to 10, and okay, let's put the IceWave on, boom, done. How's it feel? Great. Pain reduction or elimination right away. And they were random people, right, that were just there to listen about the technology. So not anyone that had been using it thus far. So it was pretty amazing, to see how fast it can work. But you have to play around with it, and that's why we want you to watch the videos. So here's a little bit more when you can look at the thermal imaging. Yes, that is a horse. That is not a human. But the thing I love about this picture is it's AccuLife. And people ask me all the time, how's AccuLife different from IceWave? What's the difference in the two? Nothing. You just can't have something licensed for pets or animals that's licensed for people. So we do use this technology on horses, on dogs, cats, cows, all of the above, and many others. But AccuLife is just going to help them with pain. And you can see the changes in the thermal imaging when the body, the horse's body, right, has released that energy. And so things are moving and flowing better with using that patch. So definitely be able to help them in their mobility and obviously their comfort level, because animals get hurt too. I remember it was maybe about 6 months or so, my Frenchie jumped off the couch the wrong way, fell down, and hurt her arm. Like, she just was limping and, laying around and all this stuff. So I go grab, of course, an X39 and Aeon. I slapped that on her, And then I grabbed the IceWave and I put that, the white on the right and the tan on the left. And by the next morning, she was up and going again. I mean, she was down for a day, but she was definitely up and going the next day and good to go. So I just kept the X39 on her and Aeon for like 4 or 5 more days, just to make sure we got everything good in there. And then poof, she's off again. So you can see here, this is just an example of someone, famous using the IceWave patches in Germany, being able to, we have many pictures like this of professional athletes that are using this technology. And you can see her arm. If you look at her arm, she has many patches on here. It looks like she probably has that tan up top, and she looks like she has a white and a couple others. So probably my guess would be an X39 and Aeon as well too. So let's talk just a little bit about synergy. 3949, foundational regeneration and muscle recovery. The bottom left, you'll see the chart. This is one of our clinical studies from just using the 49, but you can see the improvement when you add the 39 with it, especially when you look down at the pulse decrease. So being able to bring your nervous system into balance, right? Bringing that cardiovascular system into a more calm, balanced state, decreasing that is much better, right? So we look at the Aeon and glutathione synergistically. I know a lot of people tell me they'll put the Aeon on one side of the knee, the glutathione on the other, and that helps reduce the inflammatory markers, and helps, again, that detox, and helps get rid of the pain. So this is an idea that David came up with, as far as I know. I've heard him say it many times to people when we are out in different places traveling, and he's shared, a lot of people have knee pain, and he shared this exact thing. You can put the Aeon on the inside of the knee and the glutathione on the out, and put an X39 on the back of your neck, and then just stay consistent with that, and that's going to help to be able to reduce that pain in that area. So looking again at the IceWave, we look at the IceWave with the glutathione. Again, you would not think glutathione has anything to do with pain, but looking at the profound effect in detoxification for pain management, we've been able to see positive changes. This was a double-blind placebo-controlled study, and you can see there were 2 people that had no change, but 18 had a positive change using these 2 patches together. So in being able to neutralize pain as well as detoxify the body. So big synergistic effects with them. So in summary, holistic pain and inflammation, we want to get to the root cause of the problem. So what is it? Do you have, a decline in your body's stem cells? Are you dealing with oxidative inflammatory stress? Is there a neurochemical imbalance? Did you have an accident or an injury or surgery maybe? So this technology is going to promote a systemic recovery and cellular repair. So meaning throughout the whole body. We know X39 works throughout your whole body because it elevates those stem cells that are responsible for repair and regeneration throughout the whole body. And so we don't direct them. That's the key with all of this technology. With the exception of your IceWave, which is 100%, put it on the spot. It has to go on the spot. It has to work around the area. The other patches do work individually, elevating their peptides that they do, and they don't have to be on location for pain reduction or elimination. We found that. There's so many people that are just putting it on the back of their neck, and they're like, wow, my back pain was gone, or my leg pain, or my knee pain, and my wrist pain, right? How is that happening? Because again, it's systemic. It's throughout your entire body. But if you want to put the patches all over your area, like you saw that athlete doing, where she put them all over her arm, you absolutely can do that. There is nothing wrong with that at all. And if it makes you feel better and you want to just really, have that area peppered, go for it. We're totally fine with that. It's not going to cause any harm. I can't tell you your cells are all going to rush to that area. But if it makes you feel better, you absolutely can. And we know that this technology is obviously clinically validated, and we are drug-free and side effect-free. So if you're looking for a technology that reduces the side effects, right? Honestly, we have 0 adverse effects. And we can see that in all of our clinical studies. But, sometimes with glutathione being a master antioxidant, you may have a little bit of detoxing. You may have a little bit of fatigue or headache, and that's where we always recommend get some more water, get your electrolytes in, stay hydrated, right? But being able to use something that doesn't have that long list of potential side effects, including death, and something that has long-term sustainability with improving your quality of life and helping your mind and your body to feel better. So, who can benefit from this? Athletes, aging adults, chronic pain sufferers, anyone and everyone under the sun. We always say from 2 to 102. This technology can benefit anyone. So where do you start? You always start with X39, 100% without a shadow of a doubt. I'm always going to recommend the Aeon. David has said many times that technology, that patch in conjunction with X39 is vitally important. When you're elevating the inflammation, the body's elevating that GHK and those stem cells. We find this synergistic effect in helping the body to repair and regenerate faster. And Aeon is foundational for bringing the nervous system into balance and reducing inflammatory markers. So you can add patches after that based on the intensity and the chronic conditions that you have. I don't recommend you start on day one with all those patches. And if you did, you did. It's totally fine. You're still alive. I know on day 6, I put on 6 patches, or day 1, I put on 6 patches. But if you're not someone that's in on your detox game and, you know, you may not feel the best, start slow. Get used to drinking your water. You know, hydration is key. Half your body weight in ounces every day. Getting those minerals in your body, those electrolytes in your body are going to be very important for the cell-to-cell communication. This is a cellular technology. So it's important that you are using something on a daily basis consistently, whether it's, you know, some type of electrolyte amino acid blend. Our Cellergize is going to be out in a couple weeks. That would be my suggestion. But to be able to help really hydrate yourself and make sure that your body is doing all the things that it can to work correctly with the technology. Because we know this is not a miracle, end-all, cure-all, be-all, fix-all. You know, I had a lady message me last night and she's like, I've been using these patches and many of those. And she said, I still have massive amounts of stress in my life. And, you know, I have all these issues still. And I said, what are you doing to manage your stress? And she said, what do you mean? And I said, you can't just put out a patch and expect it to fix everything. What are you doing to manage the mental and emotional stress that's in your life? And she's like, oh, yeah, I'm going to need to get back into that meditation process that I practiced that I had before. And I'm probably going to need to have a little self-care on it. I'm like, yeah, you got to take care of yourself, right? You can't just expect to go full force like a, you know, steam engine just going straight ahead and then slap on a patch and expect it to fix everything. You know, I talked to somebody else today and he was talking about an injury in his shoulder that he keeps re-injuring over and over again with pickleball. And I said, bud, you may have to give it a break. Like, just give it a break, you know, because you can't get on the court and just kind of half away play. You're like full out, all in, which is great. I love that. But if your body is hurt and it's injured and it keeps, you know, the patches aren't going to get in there and fix that. If you keep re-injuring the same area over and over and over again, you got to give yourself some self-care. So take care of yourself. Be, you know, mindful of what you can do to help reduce the stress in your body, help reduce the inflammation, you know, maybe take a bath, you know, do some relaxing or go on a vacation by yourself. I don't know, whatever you need to do to have some downtime so that your body can have that opportunity to be able to help itself to heal. So thank you all for being here this evening. I appreciate you taking the time. I look forward to seeing everybody again on a Zoom very soon, and I look forward to hearing your successes with this technology with LifeWave. So get back with the person that invited you. They're going to give you more information, PDFs, studies, links, videos, whatever it may be that you need. And they're going to help you get set up with the wholesale pack that works best for you with the patches that you want. And you can always build your pack with all the patches you want, and then have the ability, of course, to, you know, just start slow with them and work your way into them. So thank you guys again for being here, and I will see you soon on a Zoom.